Hi, my name is Angie Beaston, and I'm going to do a physical assessment on this patient for nursing assessment, nursing 612. So starting with when the patient walks into the room, I want to do a general exam, just an overview, and see how he walks and his demeanor, his cleanliness, and then I also want to make sure that he's comfortable in his gown, and I want to make sure that he's already voided prior to the exam. Now that we have that established, we're also going to check his vitals. His blood pressure was 130/75. His heart rate is 60. His height is 6'2", and his weight was 200 pounds today. So now that we have that established, I'm just going to start from head to toe doing the exam, starting all the way at the top with the scalp. So I'm just going to look here. He has a very good hair distribution pattern. There's no lesions noted anywhere on the top of his head. There's no lice or nips or anything like that noted in there. I'm just going to feel for the bones in his skull. Everything is normal cephalic as far as his head is concerned. His skin is good. There's no lesions noted there. I'm going to palpate the top of his eyebrows here for his frontal sinuses and see if there's any tenderness or pain, and then his maxillary sinuses for any tenderness or pain as well. While I'm here, I'm going to look in his eyes and make sure his sclera is white on both sides and his conjunctiva is pink on both sides, and it looks good. I'm just going to palpate the lacrimal apparatus there and make sure there's no drainage or anything coming from there. While I'm here on his eyes, I'm going to have him to just close one eye here for me and take a look at this object, and I'm going to look at your eye while you look. Can you see that?
Yes.
Okay. And then open your eye, and I'll have you to look at that light back there, please. Okay. And then close the other eye and look at this object. Good. And open and look at that light, please. Very good. Okay. And then I'm going to have you to follow this object here. We're just going to check the cardinal fields of gaze. We're going to look over and up and down and over and up and down. Very good. Okay. So that's the eyes. We're going to move on and take a look at your ears here. I'm just going to look and make sure that they're symmetrical and they're at the same distance apart on both sides, and their plane is good. I'm going to look at the outside of the ear and feel for any lesions or any drainage or anything. There's no drainage. There's no redness. I'm going to do a whisper test too. I'm just going to step a few feet away. I might be out of the camera. I'm just going to whisper a word to you. Puppy dog. And if you could just tell me what I said.
Puppy dog.
I'm going to go on this other side and do the same. Bicycle. Can you tell me what I said?
Bicycle.
Okay. And then this is going to be the Rennie test. I'm going to strike this here, and I'm going to hold it to your mastoid bone. You just let me know when you don't hear it anymore.
I don't hear it anymore.
You hear it still?
Yes.
Okay. I'm going to do the same for the other side.
Don't hear it anymore.
And that air conduction was twice as long as the bone conduction, so hearing is good. I'm going to go ahead and take a look at your nose. The septum is definitely midline. It doesn't appear to be deviated. From what I can see, the inside looks okay. There's no drainage or anything. I'm just going to close one side and have you take a breath in and out. And the other side, breath in and out. Good. And I'm going to move down here to your mouth. Just going to look and see if there's any lesions or any problems with your mouth. Good. Have you to stick out your tongue and over to the side. Good. And over to the other. And can you go up so I can look at the bottom of your mouth? Good. And if you stick your tongue out one more time and say "ah" for me so I can look at the oral clearing. Good. And your tonsils don't look red, and you don't have any problems with pain in your throat. Anything right now?
No.
Okay. Okay, very good. So I do want to have you I'm just going to feel right here in your temporomandibular joint. Have you open your mouth and close. Good. And you're clenching your teeth right now?
Yes.
Good. I'm going to have you squeeze your eyes really tight. Good. And open. And have you wrinkle up your face. Good. And smile. Good. And puff out your cheeks. Very good. So we're testing the facial nerve for that. So all of those things are intact. Okay, so your nose and throat. So going down the line here, we're going to look at your neck. Both sides are smooth. There's no jugular venous distension noted. I'm going to feel your pulses on both sides for the carotid. Very good. And I'm just going to feel the trachea is midline and the thyroid is midline as well. I'm going to take a listen to your carotid pulses and your thyroid. Good, and there's no bruise. I'm going to reach kind of around the back here and just to feel your thyroid really quickly. Good, and I'm just going to have you to swallow. Good. Okay, so while I'm on your neck, I'm going to go from the back of your head here and feel all of your lymph nodes in the back here, behind your ear, and in front of your ear, and I'm going to go down your jawline here towards your chin. Very good. I'm going to go down the neck here, down the sternocleidomastoid muscle, and down the front. Good. And I'm going to go to the supraclavicular region. I'm going to make sure we don't have any problems there. Good. Okay. So moving on from the neck, we're going to go just to the upper extremities here. I'm going to feel in your axilla for any lymph nodes there. Okay, and then I'm just going to have you to turn your arm just a little and feel that brachial pulse and the radial pulse. The skin on his arm is nice and warm and dry and it's intact. The hair distribution pattern is fine too. I'm going to go all the way down and look at his nails. There's no evidence of clubbing or anything wrong with his nails there. I'm going to look on the other side as well. No problems with lymph nodes there. Okay, I'm just going to feel that pulse and that pulse. And both arms are symmetrical and no lesions noted. You can put your okay. You know, while I'm on your arms, I'm going to go ahead and just do the brachial reflex. Okay. The other side as well. Very good. So gotten this far to the arms, and then we're going to go on ahead and I'm going to have you to swing your legs over that way so I can take a look at your back. We're going to look at the, I hope I'm still in the thing there. Okay, so I'm just going to look at your spine there and make sure it's nice and midline. I'm going to have you to take a nice deep breath. Good. And both of my hands were even there. I'm going to have you to say 99.
99.
99.
99.
99.
99.
99.
99.
Good. And then one more. 99.
99.
Good. His respirations are even. They're unlabored. I'll just have you turn. You know what? Stay there. I'll take a listen to your back. Now listen here. Nice deep breaths. Good. Good. Okay, I'll have you to turn to the front, and I will listen to the front as well. Of your lungs here. Good. Good. And make sure we listen to the heart as well, and the pulmonary and aortic valve. Take a listen to here, and then I'm going to feel for any heaves or pulsation. I'm going to feel for the apical pulse right there, and I'm going to take a listen to that as well. Very good. Okay. Whoop. kind of timed me out, sorry. Okay, we did your back, pulses. Let's have you to lay on your back over here, and I'll move that chair out of the way and we can look at your belly. Just move this chair. I'm not done with that, so we'll keep that there. Okay. So I'm just going to take a look at his belly. I'm going to kind of lift up here, make sure there's no heaves or anything there as well. I'm going to take a listen to the bowel sounds and the abdominal aortic artery and the femoral arteries. All 4 bowel sounds are present in all 4 quadrants. Very good. I'm going to listen for that femoral pulse. Good. And the abdominal aortic. Good. And now I'm just going to feel on your belly, nice and light, just to make sure you don't have any tenderness with that light palpation. Good. And I'm going to go a little bit deeper and see if I can feel the spleen there and the liver here on the right. Okay. I'm just going to do a little bit of tapping. Okay. To feel for dullness of those organs. I'm going to reach around to this other side here and see if I can't palpate your kidney. Okay, and that's with deep palpation there. And I'm going to do the same on this side, deep palpation. Very good. Okay. So moving on down the line here, I'm just going to look at his legs. The hair pattern is equal and well distributed on both legs. There's no edema. The temperature is warm and even throughout. I'm going to feel his dorsalis pedis and his post-tib pulses on both sides. And those are 2 and 1. And that looks good there. I'm just going to bring that chair back over so I can do the rest of those reflexes. I'll have you to sit right back here in this chair for me, sorry. Just going to do the leg reflex there. So I'll lift up your leg here and have you to feel that. And then one more and we'll feel that. Okay. I think that was everything from head to toe. I'm trying to think if I missed anything. Anyways, I want to thank my patient for participating today, and that is my physical assessment video from head to toe. Thank you.